Thank you for joining us for VaxTalks. I'm Brad Satin, and we're joined today by Dr. Michael Miller. He is an independent healthcare life sciences consultant with Health Polcom and a board member with We Vax. Thanks for joining us, Dr. Miller.
Thank you, Brad. It's great to be here.
Today we're talking about something called LongCOVID, and I guess we start with the obvious question, Dr. Miller. What is LongCOVID?
Well, Brad, long COVID is a situation where somebody has the acute COVID or the infection with the virus, and then afterwards they continue to have symptoms like shortness of breath, fatigue, muscle ache, sometimes GI symptoms. And most concerningly for a lot of people is like brain fog, just an inability to concentrate. It doesn't happen all the time, but it happens a significant amount of the time. And it seems that there's really two types of long COVID. One is with ongoing symptoms related to the organ damage from the acute COVID, like they have pneumonia and they have continued problems breathing and shortness of breath. Another type that I believe is related to an ongoing inflammation or an autoimmune kind of situation that we see, and that can involve that continues after the acute COVID for months on end. And of course, there can be a mixture of the two, and research is going on to try to determine what's the cause of these symptoms, distinguish between the types, and a variety of ways to diagnose and test and treat.
Well, it kind of seems like we're at the point now where everyone who wants to get a vaccine can get one or should be able to get one pretty soon. So how concerned should we be about long COVID? I guess certainly if you don't have the vaccine, there's a reason for concern.
Absolutely. Vaccines are really the best way to prevent long COVID, because if you're not going to get infected, if you're not going to get COVID and bad symptoms, that's the best way to prevent it. It's also interesting that it appears anecdotally that the vaccines can help improve the symptoms for people with long COVID. That it hasn't been fully fleshed out yet. It's anecdotal. There's patient reports, particularly on young people, but we should still be absolutely concerned about the virus and getting COVID, because particularly young people, because young people may think that, well, there's not a lot of hospitalizations, not a lot of deaths going on now, it's not a big deal anymore. But long COVID absolutely affects young people and children too. So they should really be concerned, really want to get the vaccine. And if you read some of the reports among patients in the news, they're typically younger people who've been very active and now are impaired and can't really return to their normal lives because they've had months of ongoing long COVID symptoms.
Do we know how common it is right now?
That's still being researched. The director of the NIH said about a week ago at a hearing that he thinks up to 30% of people who've been infected with the virus or had COVID may have ongoing symptoms. There's been a variety of groups looked at. There was some healthcare workers who had mild COVID. 10% of them had symptoms, I think, 8 months later. A group of people, the Veterans Administration, the 8% of them months later had serious health problems, new onset heart disease, kidney problems, diabetes. So clearly something's going on. And then there was a study looking at about 500 people who've been hospitalized with COVID, and up to 50% of them seem to have ongoing symptoms about 4 months later. So it's significant, it's common. And again, some of these people 6 months out, particularly because of the so-called brain fog, can't return to their work activities. That's a real problem. And if you think about the numbers, we've got tens of millions of people who've been infected with the virus, had COVID in the US, and many more than that worldwide. If say 10% as a conservative number are having symptoms ongoing months later, that's a huge number of people and a real serious problem. It also should be remembered, Brad, that this is not a unique phenomenon to this virus. There's been other viruses and bacteria where after the acute infection, people continue to have ongoing symptoms. We've seen it with Lyme disease, what was after sepsis, and what was called chronic fatigue syndrome is believed to be a result after somebody's infected with something. It's now called myalgic, what's the term? Encephalomyelitis. I got to look down on my notes. And all of these things have the same kind of after the acute infection, some kind of ongoing problems of symptoms, probably related to a disturbance in the immune system or ongoing inflammation.
And I guess we don't know how long the symptoms could last, just how long COVID could hang on.
That's correct. I was talking to a graduate student last week who a year earlier in March of 2020 had COVID, and now a year later, when he tries to exercise, biking, running, things he used to do without problems before, sporadically he has shortness of breath. And the belief is that many people have symptoms that will slowly get better, but the research is just ongoing now.
Is there any one group that is more susceptible, maybe those with pre-existing conditions, or does it just seem to be random?
Well, if you have more severe COVID, it's a higher risk of getting long COVID. That may be again due to the organ system problems that were injured during the acute COVID. Women also seem to have higher incidence of long COVID, which may relate to the autoimmune kind of phenomenon, which is believed or possibly believed to be part of long COVID. And because women are known to have more autoimmune illnesses like lupus.
So what should people do if they think they have some of those lingering symptoms? They're not feeling better. They have that brain fog you spoke of, symptoms that just hang on.
Well, first thing they should do is they should talk to their own doctor. A year ago, when clinicians were combating the waves of acute COVID, this was not really recognized. But now a year later, it absolutely is recognized. Clinicians are getting up to speed, trying to figure out what's the right way to diagnose, what tests to do, how to treat. And by the end of this month, of May 2021, the Centers for Disease Control should be coming out with some guidance for clinicians on that. Again, how to diagnose it, what signs to look for, how to make recommendations for treatment. And then the NIH is pursuing, with a lot of funding of $1.15 billion they got at the beginning of this year, research activities into all these areas that are unknown, how to diagnose, how to treat. And they're working with patient groups that have formed to collaboratively figure out what are the most pressing symptoms and biggest problems for patients, so they can develop the ways, again, to figure out best treatments based upon the individual symptoms.
So do you have a sense of how long before we might have a better understanding? Might it be months? Are we possibly years away?
Well, we already have a better understanding because people are out there, the clinicians, the researchers, the government, and the patients themselves are collecting information and creating a knowledge base. So that's the first step. The second step is how best to test and diagnose and to monitor somebody's symptoms, and then what's the best way to treat. That's the ultimate goal, is to get resolution. And I think that'll be coming in stages over the next months, I would say, not years, certainly.
But the best advice for now, as you mentioned, is to get vaccinated.
Absolutely. If you get vaccinated, if you don't get infected, if you don't get COVID, your risk of getting long COVID is essentially very, 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 very small. Whereas, as we know, if you get infected, you get COVID, particularly bad COVID, your risks are 10, 20, 30%, depending how serious your COVID is, probably.
Well, great information, Dr. Miller. Thanks so much for joining us.
Thank you, Brad. It's been a pleasure.
And thank you for joining us for this edition of VaxTalks. And for more information, go to whywevax.org.